Vandita Sharma. I'm a psychologist by profession and I'm here to answer certain questions about psychology. So clinical psychology is a profession. It is a subfield under the umbrella term psychology. Clinical psychologists deal with multiple mental disorders. For example, depression, bipolar disorders, substance use disorders, schizophrenia, psychosis, neurosis. So, the role of clinical psychologist is particularly assessments, management of disorders, treatment of disorders. They conduct various psychotherapies and counseling, diagnosis, treatment. To become a clinical psychologist in India, you have to get a specialized degree in clinical psychology. For that, you have to do MPhil in clinical psychology. A student can do MPhil in clinical psychology after completing their bachelor's and master's from psychology. To do clinical psychology, you must have masters in clinical psychology, but to do masters in clinical psychology, bachelor's in psychology is not required. So if you're coming from any other background, you can also pursue clinical psychology. Sometimes students discover that if they're passionate for clinical psychology later in their lives. So yes, option is available for them as well. There are various institutes in India which provide specialized course in clinical psychology. MPhil clinical psychology training is provided by various hospitals and institutes in India. So students can clear the entrance examination. There are certain number of seats. They can prepare for entrances and they can get seats easily. And this is a 2 years course, specialized in clinical psychology training course. So that actually builds a competence in you to be a clinical psychologist. Clinical psychologists deal with multiple mental health disorders, for example, depression, personality disorders, anxiety disorders, to be very specific, like phobic disorders, panic disorders, obsessive compulsive disorders. Nowadays, obsessive compulsive disorders is becoming very prevalent in India. People are coming up with various problems of repeated hand washing and excessive cleaning behavior, which creates distress to them, which is intrusive. Similar other problems, which is very common, like major depression, dysthymia, and a lot of other disorders, personality disorders are there, substance abuse disorders, alcohol dependence, drug dependence. In a lot of disorders, clinical psychologist has a role to play. After COVID, to be very specific, trauma is developing in people out there. But we can also see post-traumatic stress disorder developing more in individuals now. People who have lost their family members, those flashbacks indeed come in their mind. That was a very panicking situation for them. And I have also observed in hospital setting, I see a lot of cases in which anxiety disorders are developing after the COVID specifically. So especially this sanitizing, excessively sanitizing is now developing into obsessive compulsive disorder. Checking onto themselves, checking onto their body, their pulse rate, their oxygen level is now also developing into the panic disorder, which make them feel that they are about to get panic. There is something, they are about to get a heart attack or something like that. So excessive health concerns about themselves, excessive cleanliness, and yes, trauma. It's developing more in individuals after COVID, to be very specific. Clinical psychologists use multiple therapies, psychotherapies to deal with psychological disorders. They have a structure to follow to treat any disorder. They begin by forming a rapport, assessments, history taking, examining their physical and mental status, and then they proceed towards a detailed history about the client. And for example, there are specific therapies for different disorders. There is exposure and response prevention therapy for obsessive compulsive disorder, which I have mentioned about. And there are other therapies, cognitive behavioral therapy, they utilize that. And there are mindfulness based cognitive therapy, which is also an evidence-based therapy, developing more and more in India, giving people stress-free life and very calm and peaceful life. There are different other therapies, for example, schema therapy, acceptance and commitment therapy. So clinical psychologists are trained in providing those therapies. So during their course, during their training, they get specific hands-on training in dealing with patients and applying those therapies on them. So there is a structured procedure, scientific procedure to provide these therapies. They don't just give suggestions, so just be aware that if anybody is just giving you suggestions, that's not therapy. It's a very scientific and structured way to provide psychotherapy in clinical psychology profession. So tips that I would give to everybody to lead a mentally healthy life is to keep connected with your social groups. It is very important to maintain your connections, to keep talking about the worries that you have. Sometimes you fear judgment, so that's why we just restrain our feelings to ourselves. That's important. But whenever you feel that there is need to talk about something, you can reach a profession. That's very important. Don't let it become severe for yourself. Whenever you start feeling that there is a problem, just reach out to a profession. And there are other activities that you can perform, that is just do activities which gives you a sense of pleasure and mastery in everyday life. Any kind of activity, it can be yoga, it can be just watering plants, it can be just talking to somebody, talking to a child, or just like petting. So that gives something, that gives you a sense of accomplishment, sense of mastery and pleasure, that it really is interesting for you, that you would do as your hobby. So engaging in such activities is very important. Taking out time for your peace, taking out time for your own self is very important. Nowadays we are becoming very busy in our careers, in our careers, in our work life. So it is very important to just take out at least 15-20 minutes every day for yourself to do something which really makes you feel good. So if anybody is having any problem they want to share, any concern that they want to share, you should always step ahead and talk to somebody, talk to a professional. I would really encourage you, that would be a really appreciable step to step ahead and talk to a professional. If anybody wants to talk to me and consult for a session, they can contact me on my email address and through my website.
बस ठीक है.
वर्ल्ड मेंटल हेल्थ डे कब होता है?
10th of October.